Dr. Devieux, could you speak to some of the long-term mental and physical public health issues that are going to result from this devastation in Haiti?
Yes, certainly. Thank you. Certainly, a lot of the issues that the country is dealing with right now in terms of taking care of the wounded and preventing further injuries will be there for a long time. Why? Because the international community is there now, but we don't know for how long. And Haiti has a shortage of a public health infrastructure in terms of trained personnel to deal with these kinds of issues. So, and you're likely to see, since this is not a country that has benefited from investment in infrastructure for public health, like water, sanitation, and all, you're likely to continue to see those issues come up. So certainly the threat of infections, whether waterborne illnesses, airborne illnesses, all of that are really great threats, especially that people are living in very overcrowded situations, refugee-like tents. And that's where a small cold or a flu can kill thousands of people. And the sanitation, the access to safe water, these have never existed even before the hurricane. So right now, this is a chance to do it the right way, but it's going to be exacerbated. So, but the crisis that's in the making that we are not hearing about is also the mental health issues. Post-traumatic stress disorders, we know after disasters such as that, and there's going to be a need to build capacity to deal with these types, because I don't think the country doesn't have this infrastructure. So where I see we could make a contribution, for example, is really to train paraprofessionals and people to intervene on a large scale to address some of these issues. And the vulnerable children, it is really the major casualty in that tragedy.
What's going to happen to the children and the orphans of Haiti?
Well, there were quite a number of them already. And right now, there are some orphanages, but not enough to take care of children, because there are a significant number of street children. If you go to Haiti and you walk around, and you will see, sometimes they are concentrated in some areas of town. But this is an area which I guess some organizations like UNICEF will, although they have been involved in dealing with those issues, will have to take a leadership to help ameliorate, because the long-term casualties for all these infants that are orphaned, additional infants that are orphaned, of course, will be devastating for the country. In addition to helping the victims, even the adult victims. So those are issues that will need to pay attention. And children are much more vulnerable as well to all the physical illnesses infections that we are talking about, possible outbreaks because of their immune system being, not as easily, not able to deal with with shock and trauma as well. So unless there is a special focus, it's the children, and they are about 50% of the population, 40 to 50% of the population in Port-au-Prince is categorized as children. That means under 18 years of age.